Good morning, everybody, and welcome to Sunnybrook. My name is Andy Smith. I'm the President and CEO of Sunnybrook Health Sciences Centre. Thank you all for joining us here today to talk about important new mental health initiative from the Government of Canada. With the challenges we've all experienced over the course of the pandemic, I know this will be very welcome news. We're excited to have a number of special guests to make today's announcement. It's a pleasure for me to welcome the Honourable Minister Carolyn Bennett, Minister of Mental Health and Addictions and Associate Minister of Health. I'd also like to welcome Member of Parliament for Don Valley West, the Honourable Rob Oliphant, and Pierre Bilodeau, the Vice President, Strategy and Stakeholder Engagement at the Standards Council of Canada. Thank you all very much for being here today. It's very timely that this announcement is being made today, as this is the start of Brain Awareness Week, a week to raise awareness about the progress and benefits of brain research. At Sunnybrook, our researchers and clinicians are leading the way with the research and care of brain disorders, which includes mental health, with researchers exploring cutting-edge interventions like neuromodulation, which target the circuitry using technologies such as focused ultrasound and deep brain stimulation. And, as you'll hear today, navigation and integration of care, also key components of successful mental health care, and we're proud to be leaders in these areas as well. Today, we are also pleased to have two of our talented researchers here, Dr. Robert Simpson and Dr. Markoulakis, who will speak and talk about some of their work. But first, I'd like to call on Minister Bennett to share today's announcement.
Thank you so much, and good morning. And before we begin, I'd like to acknowledge that we are gathered today on the traditional territory of the Mississaugas of the Credit, where we honor all of the Indigenous peoples who paddled these waters of the West Don and whose moccasins walked the beautiful lands of this Sunnybrook campus. Je souhaiterais remercier le Sunnybrook Research Institute de nous accueillir pour cet événement. Vous améliorez notre connaissance scientifique commune avec chaque projet que vous dirigez et chaque personne que vous traitez. Merci pour ce que vous faites. And thank you again in terms of this. When I was in medical school, the brain was certainly unmapped, and we are very grateful for all of the work that you're doing here at Sunnybrook. So here on this campus, I also can't help but recognize the leadership of the Institute of Clinical and Evaluative Sciences, who continue to examine the research and data to guide us towards policies and practices that work, and persuade us to abandon the policies and practices that don't work. Data, discovery, better health. So today, we acknowledge that at this time, when so many of us are struggling, so many having trouble accessing evidence-based mental health and substance use services, when and where they're needed, within our cherished publicly funded healthcare system, the status quo is not okay. Les 2 dernières années ont été incroyablement difficiles pour les Canadiens. Nous avons vu une augmentation claire du stress, de l'anxiété, de la dépression, de la solitude et de la consommation de substances depuis le début de la pandémie. Sadly, during this time when so many more of us need support, support is all too often out of reach. Care for those struggling with their mental health and substance use is not consistently available across the country. And when it is, Canadians are often facing long waiting lists. This is not a new problem, but like so many gaps in our health and social systems, it has been amplified by the pandemic. Those who were underserved by our health and mental health systems before the pandemic are suffering even more now. As the first Director General of the WHO, the World Health Organization, Canadian war veteran Brock Chisholm stated in 1958, there can be no health without mental health. Mental health is health. Cancer, heart disease, diabetes have standards in quality care that all practitioners and patients know and understand. And we help Canadians understand what they ought to be able to expect. They are equipped to question practitioners when they are offering service that is not evidence-based, that may be lower than what would be a clinical or national standard. So as the first federal minister of mental health and addictions, I have the daunting job and humbling job of ensuring that mental health care is treated as a full and equal part of our universal healthcare system. That means working closely with my colleagues in the provinces and territories, experts, as well as those with lived and living experiences, in order to lead a whole of society approach to address mental health and substance use. S'assurer que les gens à travers le Canada aient un accès équitable pour des services essentiels en santé mentale et en consommation de substances est une priorité pour tous les Canadiens. Building on the investments of $5 billion over 10 years in Budget 2017 to support provinces and territories to increase access to mental health and substance use, our government provided $45 million to develop national standards in Budget 2021 to help address the needs of Canadians facing challenges with mental health and substance use. So today I'm pleased to announce that we are taking the first step to develop the national standards for delivering mental health and substance use services. By partnering with the Standards Council of Canada, we will ensure that the standards will be in place to help people as soon as possible. The Standards Council of Canada, as you will hear, is a federal crown corporation that leads and facilitates the development and use of national standards. We'll be leveraging significant work done already to date in developing and advancing the use of best practices in mental health and substance use treatment. We are also investing $600,000 in 6 new research projects to inform the development of these standards. These include 2 projects led by researchers here at the Sunnybrook Research Institute. For example, Dr. Roula Markoulakis will be examining current evidence and approaches to navigation services for delivering youth mental health and addictions care. National standards are needed to address the range of mental health and substance use needs. They will guide how evidence-based services are delivered and how they will be available for use across Canada. They will ensure that Canadians will know what they should be able to expect wherever they live. Le but est de s'assurer que les Canadiens et les peuples autochtones reçoivent les soins les plus appropriés, à l'endroit le plus approprié, en personne et virtuellement, par le fournisseur le plus approprié, en reconnaissant le succès du modèle par étapes au moment le plus approprié. These services must be safe, trauma-informed, effective, free of stigma, patient-centered, and culturally and gender-appropriate, regardless of where you live. We want people to know that it does not matter if you live in Kelowna, BC, or Charlottetown, PEI, First Nations, Inuit, or Métis communities, 2S, LGBTQIA+ people. We want all Canadians to receive the same and appropriate standard of care. National standards aren't a new tool. We have seen how instrumental they have been before, such as the Canadian Partnership Against Cancer Standards for Cancer Care. The partnership informed the development of national standards for the most common as well as high-risk cancers, ensuring that regardless of where you were in the country, you knew what to expect. So now we want people to know that this extends to their mental health and substance use. To ensure that standards address the diverse needs of people across Canada, the Standard Council of Canada, as you will hear, will conduct thorough engagement with a wide range of partners, including the provinces and territories, Indigenous partners, health organizations, experts in mental health and substance use, and people with lived and living experiences. Tôt dans la pandémie, notre gouvernement a reconnu les énormes besoins en santé mentale et en consommation de substances qui n'étaient pas comblés. Nous avons agi rapidement pour répondre à ces besoins le plus rapidement possible. Working with key stakeholders, we launched the Wellness Together portal in April 2020. And just this January, we launched the companion app to the portal, PocketWell, to provide free, confidential mental health and substance use to people in need across the country. Over 2.2 million Canadians have used this evidence-based site, browsing resources, getting 24/7 crisis support, and the feedback has been hugely positive. We know that a mental health strategy for Canada will need to be built bottom up. It will need to be built on the wise practices from coast to coast to coast, like Heather will tell you about LOFT there. Les normes nationales établies avec des experts, ainsi que ceux avec une expérience vécue ou vivant, vont assurer des services en santé mentale et en consommation de substances sécuritaires, efficaces, culturellement informées. Avec des normes nationales, tous les Canadiens sauront à quoi ils pourront s'attendre, peu importe où ils vivent au Canada. Comme ils pourraient le faire s'ils avaient une maladie cardiaque ou un cancer. Les normes nationales pourront dresser les fondements pour un futur qui servira mieux la santé mentale et le bien-être des Canadiens. Together, we will ensure that Canadians get the optimal care and support they need, when and where they're needed, and national standards will be able to help us determine what is optimal. Thank you. Merci, Miigwech.
Thank you very much, Minister Bennett. Thank you for this investment in improving mental health and addiction services in Canada. I'd now like to call on Member of Parliament for Don Valley West, the Honourable Rob Oliphant.
Thank you, Dr. Smith, and thank you all for being here today. It is always very good for me to be on the campus, this campus of Sunnybrook Health Sciences Center. And it's also very good for me to be here with two people who are in the right place at the right time. And I'm referring to Dr. Carolyn Bennett, who is in the right place at the right time as Canada's first federal minister of mental health and addictions, and Dr. Andy Smith, who has become a friend and a colleague and a valued community leader in Don Valley West at Sunnybrook Hospital. I'm often fond of saying that Sunnybrook is not only in the heart of my riding, but it is the beating heart of this riding. It is the place with the largest number of employees, but it is also a place of scientific research, of innovation, of new technology, of patient care, and of ensuring that Canadians get the health care not only here, but the things that are learned and experienced here are shared across the country. I think that primarily what I want to share today is that people need help, very simply. And we stand here at the 2-year mark of a very difficult pandemic where it has never been more clear to any of us that that is help that people need in terms of bench research, in terms of getting right to the aspects of what a virus is. It is also about patient care and innovation in infection control and patient care, but also in helping people with the mental health effects and side effects of the pandemic that we've been through. Every day, in my experience as a member of parliament, I see fragility of people. I see people who are afraid. I see people who have underlying conditions that cause them to be more extremely nervous or anxious, or suffering from effects that are extremely difficult for them with mental health and addictions. And they need help, but they need the kind of help that is rooted in research. One of my experiences as a United Church minister, as a pastor for a long time, was that what added to anxiety for people with mental health was not knowing what they could or should expect, not knowing where to turn, how quickly they should be responded to, and how their cares may be considered important by others. So things like navigation projects, which help people integrate hospital care and community care and family care and put those pieces together, become not only helpful to a person, but actually healing for a person. They actually help the person deal with their illness and lower their anxiety and lower their concerns, which then leads to better health outcomes. Today's announcement is one of those foundation stones underneath what we need to do in the long run. It is about ensuring that we have the research which sets the standards, which dictates the care, which allows people to have expectations and understand what those expectations should be in terms of access to primary care, in terms of access to community care, in terms of access to mental health beds in hospitals, in terms of access to supports for not only them, but for their family. So today is one of those announcements I'm very proud of, that the federal government has taken up its role in ensuring that mental health is not only part of, but at the center of healthcare of all of us. And so we stand today recognizing that as Sunnybrook does this research, as Sunnybrook contributes in its care to the development of standards, each one of us will be better. And I thank them for their work, for the physicians and the scientists here who do that work, and also for Minister Bennett, who continues to raise this issue to allow us to advocate from within to ensure that Canadians get the health care they deserve. Thank you very much.
Thank you very much, Rob. It's always great to have you here at Sunnybrook. I would now like to introduce Vice President of Strategy and Stakeholder Engagement at the Standards Council of Canada, Pierre Bilodeau, to say a few words about how the SCC will be working to develop these new standards.
Good morning, everybody. Merci beaucoup, Minister Bennett. I'm honored to be here today to share this wonderful announcement about the effort underway for mental health. One of the most impactful ways to broadly improve the safety and well-being of Canadians is through the development and application of standards. Standards are powerful tools that can help address societal issues like those related to mental health. Standards also help develop and build public trust in services, something greatly needed in the area of mental health. Standards can take many forms, but in general, they are documents that provide rules, guidelines, characteristics, requirements for products, processes, and services. In the case of mental health, they can provide a foundation to close gaps in service delivery, such as wait times and quality. When implemented, standards can help Canadians have confidence in the health services to be safe and reliable. The process to create standards is also very robust. Standards are built on consultation, collaboration, transparency, neutrality, and most importantly, consensus. The development process requires the participation of everybody at the table, from standards development organization, industry, government, academia, and others to contribute their knowledge and advice and ensure that these standards align with Canadian priorities. With the support of Health Canada and input from the Public Agency of Canada and the Canadian Institute of Health Research, we at the Standard Council of Canada will bring together knowledge experts and interested parties to advance national consensus, guidance, and standardization on 6 key mental health and substance use topics. Everyone will have a chance to provide inputs during the public consultation that will take place shortly after. This work will provide a strong foundation from patient-centered mental health care for all Canadians and will help standardize support from coast to coast to coast. Thank you very much.
Thank you very much, Pierre. As mentioned, the development of the new national standards will be supported by 6 CIHR-funded research projects. 2 of these projects will be led by Sunnybrook researchers. Dr. Robert Simpson is a physiatrist and a scientist in the St. John's Rehab Program at Sunnybrook Research Institute, who will be leading a research project focused on implementing online mindfulness-based interventions for people with multiple sclerosis in Ontario. And Dr. Markoulakis, a scientist in the Family Navigation Project at Sunnybrook, will explore current evidence and approaches to youth mental health and addictions navigation. She's here today to talk about her research and how it will contribute to the new National Standards Project.
Thank you, Dr. Smith. Minister Bennett, Mr. Oliphant, Mr. Bilodeau, I'm honored to be here today for today's announcement, and thank you to the government and to CIHR for supporting research that will help make a difference in the mental health of Canadians. As a researcher focused on youth mental health, my team and I feel privileged to have this opportunity to contribute to the development of Canada's first standards for mental health and substance use services. Mental health and addictions issues affect an estimated 1.2 million children and youth in Canada, yet fewer than 20% of these youth receive appropriate treatment for their needs. Youth may encounter numerous roadblocks on their care journeys. They may encounter difficulties transitioning from one service to the next, or they might encounter adults and providers who don't understand their needs and concerns, meaning they don't get connected with the services they need. This might cause them to develop negative attitudes or mistrust of services, or to feel like they aren't ready to access care, which is especially unfortunate at a time that is so critical for getting them connected to the support they need to set a path for mental wellness across the lifespan. Navigation services are one impactful way to enhance access to and continuity of services. For example, at the Family Navigation Project here at Sunnybrook, specially trained navigators work with youth and their family of choice to help find the best service and support to match their needs. The Family Navigation Project is not a crisis service. Our navigators carefully understand youth and families' unique needs, provide individualized resource matches for their preferences and goals, support communication between professionals that are involved in supporting the youth, and provide psychoeducation, advocacy, and ongoing support with no time limits on service. Navigators also spend time learning about different resources in the system so that they can draw on this knowledge when matching youth and families to supports that are right for them. We consistently hear that youth and families want navigation support to find their way through the complexity of the mental health and addiction system. These navigation services have been popping up all over Canada and are an important support for youth and families to overcome their barriers to care, connect with the treatment and services they need, and feel empowered in managing their health. However, navigation service models can vary across sites and jurisdictions. These variations point to a need for a review of navigation approaches and outcomes to develop a set of standards for youth mental health and addictions navigation. We will be conducting an extensive review of existing evidence regarding youth mental health and addiction navigation across Canada, looking at academic literature, connecting with experts in the area, and connecting with navigation programs to learn about their models, teams, navigator roles, the supports they provide, and their outcomes. We will pull this information together to understand how navigation works best, for whom, and under what circumstances, which will be the basis for the navigation standards that we develop. By developing these standards, we believe that we can support youth mental health and addiction navigation programs to coordinate effectively with each other and do their best work with youth and families, thereby helping to ensure a mental health care system that is readily able to support youth and families in traversing and connecting with needed care. Many thanks again to Minister Bennett and her team, the Standards Council of Canada, and CIHR for recognizing the need for these standards and supporting this work. I'll now invite Dr. Smith back to the podium.
Thank you, Doctor, for sharing your insight into your research and its impact on the lives of youth and their families. Many thanks again to Minister Bennett and her team for today's announcement, which improves the lives of Canadians seeking mental health and addiction services across this country. Thank you to Mr. Bilodeau. And also, Rob, as always, thank you very much. Rob Oliphant, Dr. Markoulakis, and also the Sunnybrook team. I would now like to invite our moderator to the podium for a brief Q&A.
Hello. Okay, so the virtual media Q&A session will be starting shortly, and I will be passing it on to my colleagues on Zoom. Thank you so much.
Thank you. We will now proceed to questions from reporters online on Zoom. If you're a reporter and wish to ask a question, please use the hand raising function. We ask that you limit yourself to one question and one follow-up. Unless I have already stated it, please indicate your name and media outlet before posing your question. Nous allons maintenant prendre des questions des journalistes sur Zoom. Si vous êtes journaliste et vous désirez poser une question, veuillez utiliser l'option de lever la main. Merci de vous limiter à une question et un suivi. Sauf si je l'ai dit, veuillez identifier votre nom et votre média avant de poser votre question. We will start with Pietro Nagliati. Go ahead.
Sorry, my name is Gianpietro Nagliati. I work for Omni Television here in Toronto, and my question is for the Sunnybrook team and for the minister. In Ontario, about 1/3 of overdose victims are part of the construction industry. And we were wondering if there is there are some indicators of a particular problem inside this industry, even in other provinces of Canada.
Thank you so much for the question. It is so important, and as our hearts go out to all of those lives that have lost and those that have been forever changed, we know that the construction industry has been a very, very important partner in recognizing their workers that are dying, and that they want to be with us in a real partnership to do everything we can to be able to save lives and stop this national tragedy. One of the areas that we're working very hard on in terms of $60 million is the progress on safer supply of medication, of regulated supply for people who have had pain and who need their medicines such that they don't go to the street and end up really receiving the part of this deadly toxic supply. So I look forward to working with the industry, and I think that again, as we say, coast to coast to coast, that this is about experts and people with lived and living experience. Groups like Moms Stop the Harm are doing a really impressive job of changing the stereotypes about people using drugs, and really how we have to open up our eyes and our solutions to save lives.
Do you have a follow-up question, Gianpietro?
No, thank you very much. Thank you, Madam Minister.
Pierre Bilodeau here. I just want to answer partly to the question. And I mean, it's interesting to see those evidence, anecdotal evidence, but through the National Standardization Collaborative that we will put in place, this is exactly the type of information we want to gather from different sector perspective and build a roadmap. So if there's some issue in the construction sector or other sector, it is our expectation that they will come up through the consultation and the collaboration, and then hopefully, depending the size of the issue at bay, then we can establish process afterwards to implement or make recommendation for those specific industry sectors. Thanks.
Thank you very much. Any more questions on Zoom? Dernier appel pour des questions sur Zoom? We have no more questions at this time, so we'll turn it back over to the event on the ground.
So this concludes the event, and I would very much like to thank everybody for coming today. Once again, Minister Bennett, absolutely a delight to have you here to make this announcement. That's fantastic.